Pain after hysterectomy. Sometimes after a hysterectomy, it's possible to have continued ongoing pelvic pain or perhaps even worsening pain. And that can be quite a difficult concept to understand and engage with. And part of that is understanding why the pain was there in the first place and what was causing it. Hysterectomies are done for a variety of reasons. Hysterectomies can be performed because of lots of heavy bleeding, but often hysterectomies can be performed because of painful conditions or because of fibroids. And if you have an underlying chronic pain condition before you have your hysterectomy, it's likely that what has happened is the nerves that supply the hysterectomy or the womb have become overactivated and wound up and excited. And what that then means is these nerves are really very sensitive to any small slight stimulus. So something which ordinarily wouldn't cause problems, all of a sudden can cause quite a lot of problems. And that can be something like moving, laughing, twisting, could be something like intercourse, could be a simple period. And so to some extent it would maybe appear that taking out the womb would get rid of the cause of the pain, and so therefore it would make sense to follow that through. But actually that's not the case, and we end up in a problem if we follow that pathway. And that's because if the symptoms are truly of neuropathic pain, if they are sharp, shooting and burning in nature, and if they are pretty constant and chronic, the problem, although originally potentially initiated in the womb, has often evolved to develop an overactivation of the nerves which supply the womb. And the problem therefore is, if you then go and remove the womb at surgery, so have a hysterectomy, and it doesn't matter if it's done through the vagina or laparoscopically, yes, you take away the womb and the initial source of the pain, but you're still left with the overactivated, excited nerves, and so the pain is still there. And sometimes worse than that, the pain can get worse, and that's particularly the case if you have surgery that causes further inflammation, so the nerves further get excited and the pain messages going up all the way through the spinal cord to the brain continue to be sent, and the pain experience can be an awful lot worse. And that's why you need to think about a different way to manage the pain, and often we would recommend anti-nerve painkillers such as the gabapentinoids, the tricyclic antidepressants or the duloxetines, and what they will do is they will look to reduce the excitability of the nerves to try and reset the pain nervous system to bring it back down to where it was before.